In my truck, I
down
just
here.
haven't been able to
Firehouse, they're all gone.
get it for you.
All right, everyone. Call to order the Public Safety Committee meeting of Monday, May 20th, 2024 at 5:30 PM right now. Do I have the motion to approve the minutes of the special meeting of April 16th, 2024?
So moved.
Second.
All in favor?
Aye.
Aye. Moving on, now I'm opening the meeting to the public for any public comments. Anybody from the public who wants to come up and make their comments can come up now to the podium. I don't think we have any comments or questions online. So seeing none here live in the meeting at the town hall, I'm going to move on to the next item, which is the departmental updates, and we will start with fire. Chief.
All right, thank you, sir. You have the report and the executive summary, so I'll just add a couple things to that. So far this year, we've been up on the highway 44 times, including 3 times last weekend. As you know, though, the state has shut off the limited access highway funding until July 1st, 2024. Obviously, that's going to have an impact on us. However, the state rep has secured $25,000 for the town. One of the reasons was we were the top recipient of the LAH funds in the state. So we've got a little paperwork to do to get that, but that should just about cover 2 months' worth of non-funds. We had one injury in April. One of our members slipped while getting off the apparatus, hurt his shoulder. He's currently receiving treatment for apparatus. All assets are in service, and the Marine unit is at the public safety dock on the river. River's a lot lower now than it was this time last year, and hopefully it stays that way. I also like to mention that on June 8th, from 10 to 2, it's a Saturday, we're having an open house recruiting event at the training grounds behind Station 2. The rain date will be June 9th, and there'll be a lot of events there, many of which are geared towards children. Lastly, we're prepping for the Memorial Day Parade 1 week from today, and as you might have noticed, we had the troops out last weekend, and they've placed all the flags around the parade route. So that's it for fire, and I stand ready for questions.
Thank you, Chief. Any questions?
Yeah, Chief, just a couple of questions about the limited access highway fund. So you said that funding has been cut off. Is that just a timing thing, that we're still accruing the right to get that money, but it's not going to come till after July? Or basically, for the rest of the year, you're doing the work and there's not going to be any fee ever?
Yes, the second one. For the rest of the year, the funds have dried up, and they're being replenished July 1st. And that was brought to us at the Connecticut Fire Chiefs meeting, which was held in town. And the mayor and the state rep, Kerry Wood, were both at the meeting. And we happened to have a side conversation afterwards, and that's when Kerry was able to secure money for the town.
So is your understanding then that the state allocated just a certain amount of funds for this purpose, and it all got used up earlier in the year than anticipated?
Yes, that's what happened. And I understand part of what happened was for a period of time, there's a 30-day filing limit. So 30 days from the incident, you have to get your paperwork in. What I understand was they extended that for a certain period. They caught an influx of bills on it from towns, and they went back to enforcing it after that, and that pushed them over the limit by over the budget by 2 months.
Okay. And just one more question, Chief.
Yes, sir.
And you probably covered this in previous meetings, but just refresh us. What is the next major expenditure or expenditures that you have in mind with the funds? What type of equipment?
What we'd like to see is a backup self-contained breathing apparatus air compressor. Next, we have one up at Station 2, and we'd like a backup one, just in case. So that would be the next expenditure.
So, and what does that device do? Is that to replenish the tanks if they're depleted while you're on the job?
That's exactly it.
Okay.
So, and we're using the air every week, on a weekly basis. So this is an item that does get considerable amount of use. And when you think about it, also, most drill nights, we're using a bunch of bottles. So the current one's about 20 years old, but we'd like to get a backup in another station.
What's the estimated cost for that?
If we can find one used, it'll be 20 to 25,000. If we have to go new, it'll probably be double that.
Thank you.
Is that a stationary or a mobile device?
That's stationary. We looked into mobile devices, and we talked to Middletown Fire Department, who had the mobile one on a trailer, and they did not have good luck with that. So we felt that the stationary one was better.
Good, thank you.
Chief, coming back to the highway funds, so they're going to be replenished on July 1st?
Yes, sir.
So you're going to start getting, you can start filing those 30-day,
Yes,
okay. And we have, in the meantime, $25,000.
yes.
Okay, excellent, thank you.
All right.
Any questions from the mayor? Okay. Chief, you are next up for emergency management, again.
Okay. Well, we've been busy in emergency management. We've met with the representatives of some of our target hazard areas in the town to help better develop emergency management plans, specifically Burris and Henkel. Believe it or not, we monitored the April 5th earthquake. Talking to the PD that day in dispatch, no calls came in. But interestingly enough, a few days later, we went into the fire museum on Church Street. We found some of the items down. One of the cases had shifted. So I think that took a little shock there. We also had an incident at the middle school, and we had 5 different agencies working the incidents. We created a unified command post, or a unified command post was established, and the operation went very well. In cooperation with the police department, we have begun issuing emergency response guidebooks to patrol officers and providing the education to use the same. So the DOT Emergency Response Guidebook, it gives first responders, specifically fire and police officers, advice during the initial stages of a hazardous material emergency, transportation emergency, leak, et cetera. It's there to give you 10 minutes worth of good information till you can start getting resources in. So again, all the cruisers will have these, and plus the information has been brought out. Let's see, lastly, we're prepping for next month's, it's called EPPI. I can't give you what the acronym is, but it's a statewide emergency management tabletop drill. And what we understand is that the scenario will test the capabilities of the municipal unified command system, working in collaboration with town officials, local elections officials to respond to emergencies or disruptions affecting the election process later this year. So we are working on that also. So I stand ready for questions on emergency management.
None here, thank you.
Councilman?
None?
Did you say with respect to the election process?
Yes.
What do you anticipate would need some type of emergency response?
They haven't, and they probably won't fill us in on all the details. But I believe it's some type of disruption towards local elections and our ability to respond to it and maintain a unified command post.
Has that always been a thing, a
This is,
perception that there may be some type of disruption?
actually, this is new, and we just received, I have it right here, guidance on a state model plan for, let me find it here. the state model plan for election day emergencies. So it's in here someplace. So
that's fine.
Just
No,
bear
no,
with me.
I-
I'll get it to you
yeah.
at some point.
Yeah.
So, yeah, we're going to review that against a plan I saw today, earlier, and create something. But this is new.
Okay.
All right, thank you, Chief. Moving on to ambulance.
Good evening. First thing, we've had 119 calls, bringing or 122 calls, I'm sorry, bringing our year-to-date call up to 466. We just finished our EMT class. The people that are in EMT class will be taking their state exams within the next couple weeks. The new ambulance is stocked. We're just waiting to put in the radios from the other ambulance into the newer ambulance. Both of our paramedic intercept vehicles have been inspected by the state and both passed, so they're both up and running. We've done a couple different standbys at a couple daycares where we go in and talk about 911 and stuff with daycares that have called us in. Most of our calls have been falls, respiratory, although we haven't had any cardiac ambulance cardiac arrests for the month, and we had no drug or opioid related incidents. The contract with Aetna is pretty much complete. It just has to be signed, and by the end of next week, we'll have a date where we're gonna sit down and sign off on the new paramedic contract for 3 years.
It's got to come.
And
That'll go to town council before we sign
What's
it.
that?
That'll go to town council before,
Okay, yeah.
before signature.
so, other than that, we're good. No other information.
All right, any questions?
No questions here. Thank you, Brian.
Any counselor?
No questions, thank you.
I have a question.
Yep.
So you said your two intercepts are up and running, so they're on the road?
They're available, yeah, we have a paramedic truck that we use at night with the ambulance, and we've had problems with, like, it going down for vehicle maintenance and stuff, but we didn't have a backup, so we petitioned the state, we got a second paramedic vehicle to, when that one goes down, and we can just move that one right in, and there's no delay or anything in response. So, not in response, but for care for the patients. Aetna's been very helpful with when our vehicle goes down. Usually, the mechanic tries to get it back before, but if they don't, Aetna will bring down their fly car, and they'll just have one of their cars for that night until the vehicle's back up and running.
So you have two flight cars,
Yes,
but one is a backup, just in case.
yes, right.
And the one is registered and on the road.
They're both registered and on the road.
Okay, all right, thank you.
Thank you, Chief. So moving on to police.
Good evening. I'd like to start off by just recognizing our officers. This is last week was the National Police Week, where the names that have fallen are put onto the wall in Washington, D.C. And it's a week that we give some memory and thoughts to those who've lost their lives, and thank our officers for the work that they've done, particularly for across the country, but here in town as well. With the efforts of Lieutenant Smith, who's in the back, and some coordination with union members, we put together a cookout for them as a little appreciation day. It was very well received. We enjoyed some burgers and early morning breakfast across all squads. So it's kind of a nice first of its kind thing that Lieutenant Smith coordinated with Nick Ninavel's put together, and I'm very proud that first of its kind, and see it happening much more. And again, also, I'll bring up in a moment, I have Detective Lahane here tonight to talk to you, just to kind of inform you about our role and our involvement in the Hartford Auto Theft Task Force. So when I'm done, I'll call, if you don't mind, just have him to say a few words and kind of update you on our role there. The executive summary kind of speaks for itself, but of a big mention this last month, we brought on board a new officer, Officer Bouchard, who came to us from the casino, and he will be clear and on his own out of our field training process effective next week, from what I hear, as long as all stays on track. We have 2 background investigations currently active for a certified and entry-level position. We continue our efforts for both certified and entry-level hiring, and we've completed and filled our dispatch ranks with a new dispatcher. Sean Doherty is now in training. It's kind of a lengthy process because it's very technical, but expect to have him fully on board here in the next few months and on his own filling the chair. And you may have followed, we made some recent promotions to the 2 lieutenants to their positions officially. And we have a sergeant who will begin her role as a new sergeant here next week when Officer Bouchard comes on the road. And I'm still waiting for that Kalia report. It's not on the portal yet, but when I have it, you will have it. And I will have, one second, I'll have Detective Lane come up. Just want to let you know, we are working through a transition of upgrading our firearms per FBI recommendations. We've actually lowered our caliber and changed it's the same platform, but some new equipment to make our officers a little bit more efficient, better, and have the best equipment humanly possible. And I think that I can tell you that the Asset Forfeiture Fund was instrumental in funding that 100% dollar for dollar. And finally, to mention, I know we've had some discussions about some of the materials posted on West Street back earlier this month. We have instituted ATV patrols with our ATV unit and are conducting periodic patrols of Corey Park, maintain that as best that we can as call volumes permit. And if you'd like me to bring up Detective Lehane now, or?
Yeah, let's get him out here, and then we can go to the questions. Thank you. You should have a mic there.
Can you hear me? Yeah. Okay. Good evening, Detective Lehane with the Detective Bureau over here at Rocky Hill, obviously. So Chief Klett asked me to give you guys kind of a quick rundown on the Greater Hartford Regional Auto Theft Task Force and kind of our roles and responsibilities as far as that goes. So the task force is comprised of 11 different agencies, detectives assigned to the task force on usually a weekly basis where we conduct our operations. It's primarily unmarked detectives in soft cars, and we clandestinely follow these cars around. Obviously, with the pursuit policy in the state of Connecticut, we can no longer pursue cars, and this seems like it's a pretty effective way to get these guys. It began back in October 2021 when every municipality around Hartford kind of realized that we have a pretty serious issue with these stolen cars and violent crimes that stem from those cases. That's when we started. Hartford started as well. So that's kind of the overview of the task force itself. So on a picture to Rocky Hill, we obviously have a lot of the cases that these other surrounding agencies are experiencing as well. So we identified a crew. We had 4 cases since February. So there was an armed robbery at the Cumberland Farms on February 3rd, burglary at the Exxon on April 1st, a burglary at Golden Opportunities on April 6th, and then again on the 24th at Golden Opportunities. With collaboration of all the other units and the police departments involved, we were able to develop suspects. The investigation really, towards the end of April, focused more on the apprehension portion of it, just because these guys were they were increasing their how many crimes they were committing at a time. So the last week of April, we arrested the 4 on the strength of Glassberry warrants, and we're actively working those cases. Obviously, the ideal is to get arrest warrants for these guys, and I expect that to happen soon. Yeah, so it really the big push to the task force itself is these frequency and these criminal crews that are kind of stealing cars in surrounding cities, and then they commit these sprees where they do, upwards of 10, 15 crimes while they have the stolen car, then they dump the stolen car. And obviously the task force has been instrumental in arresting a lot of these people and taking them off the streets for us. So that's about all I have. If anybody has any questions about the task force itself.
Is it a full-time position for you?
It is not. So it was originally in October. Now we go on a weekly basis to conduct operations.
Thanks. You mentioned 4 people were arrested. Did they do all 4 of those burglaries? Or are they suspects of them for our
Yeah,
town?
there's some information. Obviously, we're still working on arrest warrants, but they are the 4 suspects for this case. And that crew from November 30th until we arrested them the last week of April, we have a running tally of about 56 cases, just under 20 armed robberies,
Wow,
various burglaries.
great job. Thanks.
I'm sorry, can you just clarify the status of those 4 suspects? I thought you said they were arrested, but also said that you've applied for warrants.
Yeah, so they were arrested on the strength of a Glassberry warrant.
Got it.
So they're still locked up. We're working our way through our cases now. Obviously, that's a lengthy process. These guys have committed a whole bunch of cases, and it's going to be a while. Well, not a while until we get arrest warrants, but we're nearing that. But obviously, search warrants, all that stuff is pretty laborious. So
Right.
that's kind of what we're going through now.
Okay, so they're in custody for things they did in other towns, but you're working.
Yeah,
Add
it's
charges.
specifically the February 3rd spree that they committed. They did an armed robbery. I think there was 14 cases between February 3rd and February 4th that this crew is linked to, including 5 or 6 armed robberies and various burglaries, carjacking in Newington.
Oh, okay, good work. One question about stolen cars. I picked up some information recently. Tell me if this is consistent with your experience. I've heard that car thefts in general have been pretty flat for quite some time, but almost the entire spike is Kias and Hyundais because of that vulnerability they have to being hot-wired and with all that information being distributed on social media. Does that sound accurate to you?
So I can tell you the city of Hartford last year had a 500% increase, I believe, or 100%. Don't quote me on that, but it was a pretty significant spike due to the Kia and Hyundais. And the city of Hartford was tracking all of their stolen cars that were stolen by this flaw in the ignition system. From October 21 to the beginning of 23, there was a pretty significant decrease because we were going out and frankly arresting all these kids it's all the same crews, right? So they're stealing cars in Newington, they're stealing cars in Rocky Hill. We're able to collaborate and kind of put all of our heads together and grab these guys, which was very effective.
Okay, thank you.
Mayor, you have a question?
I just want to say you're doing an outstanding job on the task force, and I think one of the best things, one of the really good things that came out of the police department during COVID, among many, right, but was the creation of this task force. And so thank you for that hard work. I know that with the car break-ins during COVID, the task force was really instrumental in making a bunch of arrests, and I want to commend you, Chief, for the continuation of the program because it's quite beneficial to the community. So thank you both.
Thank you.
Yeah, and I second the mayor's thoughts here. Thank you for all your hard work, and keep it up. Thank you. Thanks, Dave. Thank you. Thanks for the update.
Thank you.
Thank you, Pat.
Any other questions for Chief Klett?
I'm just curious, what weapons you guys carry now, and what are you going to? What calibers?
I'm not a gun guy. That's the crazy
Okay.
thing. We're transitioning the platform to a 9mm from a 45. I believe we're carrying the 21s or 30s. 21s, and they're going down to a 17. Effectively, it's a 9mm platform, but coming with the very high quality optics as well as the flashlight on front. So our officers are going to have a very effective piece of equipment to keep themselves safe. I don't want to talk too much about bragging about weapons, but it's as good as money can buy, and I'm proud to be able to put them on their hips and keep them safe and make sure that if we have to do something like that, they're gonna make it count.
Good. And thank you for bringing in your detective tonight to
Absolutely.
discuss that. One last question. How's the Colby Road incident? How's that going?
So it's still actively being investigated. My last update was that some evidence from that incident had been submitted to the lab, and we're waiting for a lab report to come back.
Thank you.
Also, Sala?
Nope, nothing. Thank you for the
Mayor, do you
report,
have a
Chief.
question? You have a question for Chief? Okay. Thank you, Chief.
Thank you.
So moving on to. Oh yes, I think
Yeah, we skipped.
we skipped that. Sorry about that. Dave, you were not in the front row like you always are. So
Couldn't get away, Dave.
yeah, you're right here. I can't miss
I know.
you.
Well, Fran, I knew I was.
Thank you.
I was
Thank-
in
thank
because
you for
Fran
reminding
looked
me.
at me. I was like, "Oh, it's over." This is Dave Kemp. I'm the operations manager for Aetna Ambulance. Submitted the executive summary, so I'm not going to spend too much time on that, just because I feel like we're doing really good. Knock on wood, moving along. Really proud. We got 11 people coming in. They start next week. 2 full-time paramedics as well as 9 EMTs. We just finished some onboarding of 4 EMTs, so we're doing continuously hiring, and that's pretty standard for us. We just, particularly right now, we're trying to get all the college kids, get them situated so that when the summer comes, we have summer help. That's kind of, we're pre-planning for people to go on vacation so that we don't have any staffing issues down the road. That's been a really smart tactics work for us the last 4 years. And also gets those college kids an opportunity, those PA students, the med students, anybody who wants to go and kind of pursue their career further in medicine. This really helps them get those hours. Cardiac arrests, we did see 2 cardiac arrests last month. One was transported, one was presumed on scene, and we did see 2 opiate-related encounters. Something that we'll just keep an eye on. It does look like the opiate encounters are maybe slightly up this, year to date compared to last year. But these things, they're such small volumes that it's kind of hard to really say, which way it's going. I'm not going to get my, tails up for 2 opiate-related encounters. But, each one is important, and we'll kind of watch it to see how things are going. Usually, the trend's very simple. Like, we'll follow if Hartford has a trend, we'll see that coming down the Silas Deane Highway, because that's a thoroughfare into Rocky Hill and Weathersfield as well. So we'll kind of see those things. But other than that, that's my operational update, and I'll stand ready for any questions.
None here, thank you.
None here?
So, David, it looks like you had a few incidents of opioid-related incidents, and I don't think.
It just didn't fall when we were on duty.
Yeah, it was
could've-
probably timing.
It was just an issue that they had,
Yeah.
during the hours of the,
Yeah.
or it could have been when our ambulance was out on a call already.
Sure. Sure. I mean, that's good news
Yep.
that we're
No.
not seeing a lot. So I just wanted to confirm. And then, so they are still in line with what you see pretty much
Yeah,
from year over
it's
year.
usually proportional, without saying the numbers out loud, but it's usually a proportional thing that we see. If we see an increase in Hartford, we see an increase kind of everywhere.
Okay.
And I wouldn't say that we've seen an increase really in Hartford. I think, it just occasionally we'll pick up kind of onesie, twosies here. I think if we ever see that spike up to above like 3 or 4 in a month, and we see that over a course of a couple months, then we got to start thinking about maybe some plans to put in place, either through community education or outreach or whatever, to try to get some word out there that there might be some bad, I don't want to use the word bad, but just some more potent drugs out there. But not seeing that as of yet.
Thank you.
You're welcome.
If there are no other questions, thanks, Dave.
All right, you're welcome.
So moving on to finally to the health district. Charlie.
Hello, everyone.
Hello.
How are you
Hello,
doing,
everyone.
Charlie? You're on.
So, not a lot to report as far as infectious disease goes. We are watching the new variant of COVID, the FLIRT, that's nationally starting some upticks, but nothing that we can see for certain here in Connecticut. Also keeping an eye on the highly pathogenic avian influenza that's crossed over into the cows. But once again, very low risk here in Connecticut from that, but we are keeping an eye on it because it's a national concern. Some things that have gone up and that we do need to be conscious of, Mpox or monkeypox as it was known. We've seen more cases of that here recently in the month of April than what we expected. So that is something that we're going to be looking at, especially just keeping an eye on to make sure that those cases are spreading within the community where we wouldn't expect them. Additionally, we're in the summer months. So looking at mosquito-borne illness right now, I was speaking to the state epidemiologist, Dr. Len Sosa, last week, and that is one of the major concerns that we have going into the summer months, especially with as wet of a spring as we've had. Mosquito-related diseases like West Nile virus, Triple E, are things that we do need to be able to take into account and to prepare for. So, dumping out water, not having places where mosquitoes can breed is something that every resident can take a hand in. One last note, we are in the month of May, so our walking competition, our Walk This May competition is actually we're about 2/3 of the way through. So Rocky Hill definitely needs to step up like they have in the past and get out there and walk, be active, and be good for your community. So with that, I answer any questions.
Councilor Salo?
None here, thank you for the report, Charlie.
Charlie, could you just explain about the monkeypox? Maybe not.
No, or not.
Maybe not.
Say that again.
The monkeypox you mentioned, how did it get into our state and how active is it? And what's the signs of it?
I'm sorry, I'm having trouble hearing you.
I'm asking about the monkeypox. Can you explain what it is, what the signs are, how it got into our state, and is there many incidents of it in our state?
Yeah, monkeypox is similar. It's like a derivative of like smallpox disease. It's a rash-based disease. Typically, they have outbreaks within Africa, and we're seeing an outbreak right now within Central Africa. What we've seen is that here in the United States, it's more of a sexually transmitted disease. So you're seeing, similar to what HIV and AIDS was back in the 80s, we're seeing spread among, men who have sex with men, and within the homosexual population. What we're concerned about with respect to this, there is a vaccine for Mpox. So trying to be able to get out there and be proactive within the communities to get them vaccinated so that we can protect them, but also so that if people recognize the signs of monkeypox as far as that's concerned, of Mpox, that would be key to be able to go to their providers if they do have rash, fevers, those types of symptoms.
Is there death related with this, sir?
Charlie, are you there?
Charlie, is there death related with this or just the rash stuff?
There have been deaths that have been associated with it in Africa. There's been at least one or more deaths here in the United States. The numbers are fairly low. But what they're concerned about as far as CDC and the state health department is that they're seeing some cases, especially here recently, that are not connected to cases that are known. So we're starting to see spread within, the population that isn't attributable to a known case. So there may be some underlying disease within the community. That's why we're bringing it up.
Thank you for the info. Very helpful.
Thank you, Charlie. Thanks for the report. Unless there's a question from anybody else. I don't see any, so thank you, Charlie, for that report.
Yeah.
See you next time.
Thank you.
Yep. All right, so moving on to the next item on the agenda, old business. We don't have anything on that. After that, new business, we don't have anything. Ray, right? Anything on the agenda right now? Other business? Don't see any. So can I have a motion to adjourn?
Move to adjourn.
Second.
All in favor?
Aye.
Aye.